So hello ladies, this is such a privilege to be with you today. My name is Beverly Cheserem. I'm a neurosurgeon and I'm based at the Aga Khan Hospital. So we're going to get to know each other a little bit. Thank you for the questions that you sent. And yeah, let's get rolling. So a little bit about myself. I grew up in Kenya, went to the regular schools. I was at Our Lady of Mercy, for those who know it. And then I went to Precious Blood before I did A-levels at Arboretum College. Then I was fortunate enough to go to the UK to do my medical degree, where I went to Southampton. And from then on, I had a period of postgraduate training. That's training that you get after university. And I subsequently trained to be a neurosurgeon. So you're probably thinking, what does a neurosurgeon do? I operate on people basically through all their life, as long as the problem is to do with their nervous system. So that's your brain, your spinal cord, so the thing that runs on your back, and all your peripheral nerves. And it could be a range of things that would bring it to my attention. It could be an accident, it could be a tumor, could be an abnormality in how you were formed, could be pain, and that requires addressing, or could be the changes that come with age. It's such a wide range, and indeed, from time to time, I see women when they're still pregnant because they've had scans that show abnormalities or changes in the baby that need to be addressed. Yeah, so that's me. So I grew up in a close-knit family. My dad, my mom, and my 3 sisters. So all girls, no boys. And I had a lot of influence from people around me. My uncles, my aunties, my cousins. It was a big house, it was a warm house, and also our neighbors. And what I got is I was constantly challenged to be my better self. I didn't grow up with any gender roles because there was no roles in the house. If the car needed to have its tires changed, we did it. If the house needed cleaning, we did it. If something needed chopping, we did it. And so I just grew up experiencing life in the fullest, doing so many different things, and I really enjoyed it. So the people that I'm really grateful for are my parents. They gave me every opportunity they could. They spent a lot of money getting me books, taking me to museums. They would get me to try new foods, take me to the park. So I would go to Uhuru Park, on days off, City Park, or if we were traveling to go and see our grandparents, they would often stop at different places and let me try different things, try different foods, look at different animals. So my life was always, no wonder I like science. I really was always brought up to be curious. And then the other people that I really were grateful to were my teachers. So they were constantly pushing me. Even if I did well in something, they would call me and say, we think you're capable of more than this. So they would give me extra homework. The librarians would give me extra library cards. So everyone was trying to make me better and better and better. And I'm very, very grateful for that. What motivates me? Well, actually, I just like to learn new things. I'll tell you what I did this weekend. I was baking. The weekend before that, I might be doing something around art, or I might be doing a puzzle, or I might be reading a book, or going to, So I'm trying to always make myself a better person. And I'll show you something that's really important to me. So this is one of the things that really motivates me. When I was in primary school, I used to come, top 10, but never number 1. And I went to my dad and I asked, every time I'd go home very proud of myself. My father asked me, how come you can never be number 1? And I had so many excuses. Oh, the other girl is like this, and the other girl is doing that, and we had just moved from another town to the school. I had so many excuses. And he told me, what you think you are. In other words, whatever's in your mind and you think that's who you are, that's really is the limit to how far you would go. So I rose to that challenge. I was like, well, if daddy thinks I can do this, then I should try. And so I studied hard and I became number 1. And I was so excited, and I came home really excited to tell him. And he looked at it and he hugged me and told me thank you. That night, he brought me this. And what it says is, becoming number 1 is easier than becoming than staying number one. That was one of the most important things I've learned. No matter what success I've had, to maintain it, to get to the next level, is going to take more out of you. So if you are reading for standard 1, standard 2 will take more. If you're reading for standard 8, form 4 will take more. Every next challenge requires something new and deeper from you. So hey, I've had this and I have traveled the world with it to remind me that whatever it takes me to get somewhere, I need to do more to stay there and go beyond that. What's that one experience that confirmed that you wanted to be a neurosurgeon? I didn't really know I wanted to be a neurosurgeon even after I finished medical school. I liked so many subjects in school. I liked art, I liked music, agriculture. I liked all the different animals, I liked being outside. So I enjoyed school in many ways for the variety. And then as I got older, I knew I wanted to do something in science, and I was motivated by my mother, who's also a doctor, to study medicine. But in medicine, I was really confused. There were over 80 careers that I could choose, and it took me some time. But the thing that really changed my mind around neurosurgery is when I went to watch an operation. And I remember being so taken aback by the idea that we were in someone's brain. The person was still thinking. They were asleep. And then when we finished, and it was through a very small hole, when we finished, the patient woke up and went home. And I started to wonder about the mind, and that led to trying different things and eventually to where I am. So it was a journey. I didn't know when I was young what I wanted to do, but every step I took me to somewhere else. And that's, you've got to try what comes your way. What subjects did I take to school? In school, so that I can become a neurosurgeon. Well, if you did 844, which is me, so that tells you how old I am, not CBC. So I did all the subjects. In primary school, you don't have a choice. And when I was in secondary, I did all the sciences and geography, physics, biology, and then of course you have to do maths and Swahili and English. Then when I finished that, I did A-levels. And in A-levels, that was British A-levels, I did biology, maths, and chemistry. And from there, I went to university. If you do the system in Kenya, you just do the combination that has science to go into medicine. And then once you do that, in medicine is when you get to choose which direction you're going to go. So you don't have to worry if you don't know where you're going. Just do the next important thing. And then of course the most important thing I was told when I was in high school is if you're studying, study as hard as you can. You have more options if you have an A than if you have a B. You have more options if you have B than if you have a C, etc. So even if you don't know what you're going to do, just work your hardest in school, get your highest grade, because then there are more options and choices, even if you're not exact about which direction you want to go. Do I mentor girls? I mentor boys and girls. And how do you get to be mentored by me? At the moment, most people, they approach me and they ask me. If I say yes, that's because we've agreed that there's something that you can learn from me. And sometimes I have to say no because as well-meaning as your request is, I just don't have the time, or I think that someone else would be better for the kind of mentorship you want. So it doesn't matter if you're a boy or a girl, I'll still mentor you. So you ask, what are the highs and lows in your career? Well, if you do neurosurgery, it's really like walking a tightrope. Like an acrobat on a rope that's really tight, and you're trying to balance this way and balance that way. If I look at the job itself, sometimes I can do my best work and spend a lot of time, and still the patient can have a complication. They can have a stroke, they can bleed, and sadly sometimes I lose my patients. That is, they die. And that's very hard. And sometimes I go home and I spend some time with myself. Sometimes I even cry or talk to other people because it's hard to lose. You feel like you've not done the best for your patients. The highs are when someone comes and they do well, and particularly with children, when the next time they're coming into your clinic and they're giving you a high five, you feel like you've really helped someone. Sometimes it's not even about whether someone got better. If somebody has a condition and you can't have a treatment, being able to sit with them and tell them the truth and guide them and take care of them is also satisfying. Then there's the other price. Because neurosurgery is unpredictable hours and can be very long, the other challenge is your personal life. I'm not always there for my friends and family for their birthdays and dinners and chill out sessions, because if I have a patient, I have to go and see them. But on the other hand, many of my friends and family are very flexible and they create surprises and we have fun. So it's always a bit of a balance. Sometimes you win, sometimes you lose, but every day you try. How many years from school did it take you to become a neurosurgeon? It took me quite a long time. It took me almost 20 years after I finished Form 4 to finally be where I am today. Because you need to finish high school, and then after high school you need to go to university. To go to university to do medicine is somewhere between 5 and 6 years, depending on your university. And then you have to be a junior doctor or an intern, and that takes 1 to 2 years. And then you have to try and get into a dedicated program for neurosurgery. And it took me a little while. Remember the highs and lows? Sometimes I got it, sometimes I didn't. And it took me a bit of time to get everything I needed to get into residency. Residency in Kenya is 6 years long, but in the residency where I did it in the UK was 8. And then after that, I had even extra training above that took me another 3 years. So in total, training after high school can be anything from 15 to 20 years to become a consultant in neurosurgery. And a consultant is someone who is fully qualified and in charge of the medical team. So when you come into hospital and they tell you I'm the consultant, they not only are responsible for their decisions, but also for that of their team members and for training. What one advice would I tell my younger self? You know, the world is changing now and there's so much technology and so much choice. I would say do your best in what you're doing, but also look beyond your syllabus. If your school is only about maths and biology, what do you do with your weekends? Are you painting? Are you drawing? Are you creating content? Just explore life, and in that exploration, you will find what your passion is. I didn't know I would end up here today. I didn't know I was going to talk to you today. But if you try different things and you remain open, life has a way of giving you pleasant surprises. So yes, that's what I would tell my younger self. How are you breaking the bias in everyday life? The truth is, I didn't know what biases were. I think here when we say bias, we mean if somebody, for some reason, doesn't give you the same opportunities or looks down on you or discriminates against you because of either your color of your skin or your gender, your male or female, or your height, or where you come from, or your accent. I didn't know all these things, so as I said, I grew up in a house where we didn't have any barriers. So I'm not sure if I can say I'm breaking any barriers. I'm just trying to be my true self. And if that breaks barriers, well, that's another thing. But yeah, thank you for asking to talk to me today.